services for the deaf, hard of hearing, and deaf-blind team. This morning for our professional development, we have Elizabeth Seliger from Wisconsin Sound Beginnings and her team of Jeannie Gustafsson, Connie Stevens, and Chris Cometer. So I am just going to turn it over to them and let them do their introductions, and we will go from there. Karen, can you please mute your video for us? And I'm going to mute mine as well. So if you have questions, go ahead and put them in the chat.
Good morning, everybody. I'm so pleased to be here with you today along with my team. My name is Elizabeth Seliger, and I'm the Program Director of Wisconsin Sound Beginnings, and that's what we're going to be talking with you about today. I'm a doctor of audiology by training. I have a background in infant and family mental health, and I've been in this job for almost 21 years since newborn hearing screening began in the state of Wisconsin. Our program is always evolving, our team is evolving, so we're really happy to just give you the state of affairs related to early identification of infants and toddlers who are deaf and hard of hearing. With me today, I have 3 members of our team. We have more members of our team that are not on with us today, but I'm going to let each of the 3 folks who are with us introduce themselves. I'm going to be presenting the majority of the material, but I'll be asking them to pop in and add to as we go along. So Connie, can you go ahead and introduce yourself?
Sure. Hi, I'm Connie Stevens, born in Wisconsin, and I've been on the WSB team since 2009. Before that, I was also part of the team as a guide by your side parent guide through DPI and WSB. I am a parent of a child who is profoundly deaf and has Down syndrome. She is living at home with us, like probably a lot of other people's kids, but she uses sign language for the most part. Tried hearing aids as a baby, tried a cochlear implant till about a teenager, and so where our focus is really sign language. And then professionally, I worked for Wisconsin Sound Beginnings as it was initially follow through, which I think Elizabeth will talk a little bit about. And since 2017, the main focus has been as parents reaching out the lead with Jean, and then we had another couple parents in the last few years help us reaching out to families. And I think we'll just talk more about it later.
Yep, we will.
Thanks.
Jeannie, will you go ahead and introduce yourself?
Hi, I am Jeannie Gustafsson, and I work and live in Chippewa Falls, Wisconsin. And I have a similar background with Wisconsin Sound Beginnings and Guide by Your Side as Connie does. I probably started maybe a year with maybe 2010 with Wisconsin Sound Beginnings, but did the follow through program with the Guide by Your Side program also. And I have a daughter. I have 2 sons and a daughter, and my daughter is 25, and she has a bilateral, moderately severe hearing loss since birth and has worn hearing aids since about 4 months of age. And I do both follow through or follow up work, trying to get families that's child hadn't passed a hearing screen back in for repeat testing or diagnosis, and then also some parent to parent or parents reaching out work also. So
Thank you, Jeannie. Okay, and Chris, go ahead.
Hello, I'm Chris Cometer, and I am probably the newest member of the Wisconsin Sound Beginnings team here on this this call. I've been officially since June 1st, but working for a few months with Wisconsin Sound Beginnings as an early intervention coordinator. Prior to this, I was the program director at Here Wisconsin for 17 years. I'm a teacher for the deaf and hard of hearing by background. but my focus has been early intervention for most of the past 20 years or more. That's about it for now.
Great, thank you, Chris. So before I get started on the presentation, I just want to acknowledge our other team members. We do have another follow-through coordinator who works out of the City of Milwaukee Health Department named Susan Piccioni. She's been with us for over a decade as well, doing loss to follow-up prevention. We have a home birth midwife who is part of our team named Noelle Fernandez, who was our specific hearing screening liaison for infants born at home. Does a lot of work with the Amish and Mennonite communities as well. And then we have a whole sort of IT team behind us as well. So we do have an information technology system that I'll talk about a little bit later. And we have a person who is the administrator of that. And then we're constantly improving that system as well. And so have a variety of folks who are helping to support that. Okay, so now I'm a pretty informal presenter. So I'm just gonna ask right now, do I go ahead and share my screen so folks can see the slides?
Yes, go ahead and share, Elizabeth.
Okay. All right, let me see if I can. It's telling me okay, got it. Are you all able to see the slides?
Yes.
Okay, so now I can't see the chat box, correct? I shouldn't be able to?
This is Stacy. I believe that's correct. So if questions pop in there, I will watch for an opening and let you know.
Okay, and then you had wanted me to put in a link later, and it sounds like I won't be able to do that while I'm in presenter mode. You wanted me to put in the video link into the chat box? How should I do that?
Is the video link in your slides? Because I can grab that and put it in when the time is right.
It is not.
Okay. I think what we'll do then, Elizabeth, is just have you stop sharing your screen when it comes time for the video, and then you can put the link in the chat to everyone so it shows back up for you.
Actually, I think I just figured it out. I put it in there. Let me know if you can see it. It's a Vimeo link that should have just gone into the chat.
I see it, Elizabeth. This is Heidi.
Great. Okay, so you can ignore that for now. I'll reference it a little bit later, but I can actually see the chat screen now. So I've got my presentation screen, the slides, and then the chat up. So, okay. All right, well, like I mentioned earlier, I'm the program director of Wisconsin Sound Beginnings. Wisconsin Sound Beginnings is a program out of the Wisconsin Department of Health Services, Division of Public Health, Family Health Section, Children and Youth with Special Health Care Needs program. So that is where we are located. Our home office is 1 West Wilson Street in Madison, Wisconsin. But as you learned from our introductions, we have staff situated throughout the state of Wisconsin, and we work as a remote team. With COVID-19, that's more true than ever before, but we've been working remotely as a team for a long time, so not too new for us. Okay, I'm gonna try to advance my slide here. There we go. So I don't have a lot of slides for you today. Most of the presentation is going to be me talking. Part of the reason for that is that we have a information review process within the Department of Health. And as you can imagine, that information review process is pretty swamped and prioritizing new information, guidelines, policies, and so forth on COVID-19. So I have just a few slides, but a lot of information for you. this slide represents the continuum of our program and where we began and where we are now. So this picture was taken in about 2002. This is a picture of Maggie. Maggie was born in a small rural hospital. So in 1999, the state of Wisconsin passed universal newborn hearing screening legislation. And that legislation was a directive to the state of Wisconsin to assure that infants were born in hospitals that had a hearing screening program. In 2000, we had 2 hospitals that were screening newborns universally for hearing loss. And by 2005, we had about 80% of hospitals who had implemented a newborn hearing screening program. Prior to universal newborn hearing screening, the average age of identification of children who were deaf or hard of hearing was around 2.5 or 3 years of age. And this directive asked that we reduce that age of identification to less than 3 months of age, or at birth, as close to birth as possible. So Maggie was born in a rural hospital that had just implemented newborn hearing screening. She was the second babe in the hospital to be screened. She had a healthy pregnancy. She had no risk indicators. She had a healthy delivery. No one else in her family was deaf or hard of hearing. So through universal newborn hearing screening, she actually was identified at birth as profoundly deaf in both ears. And as you can see, this little face, she is being fit with her first set of hearing aids, and she is less than 2 months of age in this picture. Without universal newborn hearing screening, it's very likely that she would not have been identified as deaf or hard of hearing until much later in her toddlerhood or early childhood years. With these early interventions of identification, amplification, access to early intervention skills, she was able to sort of achieve developmental milestones on par with her typically hearing peers. So what happened for Maggie is what we really wanted to happen for all kiddos, that they were early identified and their families had early access to choice around communication and language development. Okay, I'm gonna move on here. So the Wisconsin Sound Beginnings program is 100% grant funded. So we have grants from the Federal Maternal and Child Health Bureau, both a specific grant targeting newborn hearing screening and follow-up, so early hearing detection and intervention, and also from the Maternal and Child Health Block Grant. That allows our program to hire our staff. It allows us to contract with external providers for different goals and objectives, and so on and so forth. So our program vision is that all families have equitable access to a seamless system of early and continuous hearing screening, timely and skilled diagnostics, and quality interventions to enable children who are deaf or hard of hearing to thrive. So that vision statement really encompasses all of the different areas of our program. We also want to make sure that parents, as they're going through the journey of learning that their child is deaf or hard of hearing and making really important decisions, and are feeling supported every step of the way. I should also mention, I mentioned that we had screening legislation in 1999. In 2010, that legislation was strengthened quite a bit to require not only that babies be born in hospitals where hearing screening programs existed, but that we actually assure that 100% of infants are screened, are offered screening, regardless of where they're born, and indicated that physicians and midwives had some responsibility in helping to assure that that happened. So that happened in 2010 and really increased our scope to assuring that infants were not only offered screening in the hospital, but sort of anywhere that they were born. We are guided, so the Wisconsin Sound Beginnings program is guided by the National Committee on Infant Hearing, so JCIH, the Joint Commission on Infant Hearing, which puts out recommendation statements that sort of set the guidelines at the national level for how state early hearing detection and intervention programs should operate and what our benchmark measures of success are. These measures have been in place for a long time that guide our work. So we assure that babies are screened by 1 month of age so that they can have a diagnosed hearing loss no later than 3 months of age, so that they can be enrolled in high quality intervention services no later than 6 months of age. So this is has been our guiding principles for a long time. A new Joint Commission statement was recently released that asked programs to consider reducing these benchmarks to screen by 1 month, diagnosed by 2 months, and enrolled in early intervention services by 3 months. We haven't adopted that just yet in Wisconsin. We're still using the original benchmarks to guide our work. But there is a strong belief that the earlier, the better in all cases. So we have successfully gotten 100% of hospitals to be universally screening infants for hearing loss. And we have also gotten 100% of licensed midwives to be screening infants for hearing loss or making a referral shortly after birth to an audiologist for that hearing screening. We also have a pretty good number of lay midwives or birth assistants who are also screening infants for hearing loss. If a baby does not pass the screening, unlike some other states, Wisconsin doesn't mandate whether the baby goes back to the hospital or is referred to an audiologist for outpatient rescreening, or if they're sent immediately to an audiologist for a diagnostic eval. The Joint Committee recommends that a subpopulation of infants who have risk factors, if they fail the hearing screening at birth, are sent right immediately to a diagnostic evaluation. But the majority of kids are sent for a second screening as an outpatient, and only if they don't pass that screening are they referred on for a full diagnostic evaluation. Because there are several steps in the process, screening and then rescreening and then diagnostic audiology, and depending on where a family lives, that can happen at 3 different locations, or and those 3 different locations can actually be in 3 different cities, depending on how rural families are. And so that is a pretty complicated process for families to navigate right after having a baby. And so Wisconsin Sound Beginnings has a pretty robust loss to follow-up prevention system in place. So part of what we do is that we track through our data system called WeTrack, which it stands for the Wisconsin Early Hearing Detection and Intervention Tracking, Referral, and Coordination System. It's an online, real-time, web-based data system that every hospital and every audiologist who sees infants in the state of Wisconsin uses. And if we notice that a baby has not passed a hearing screening and has not gotten timely and appropriate follow-up care, then our loss to prevention follow-up experts step in and start to work with that family's providers to be a safety net, to make sure that families can have access to follow-up care, that families understand that they need to go to follow-up, that they understand where they need to go for follow-up, and to problem solve any barriers to getting the follow-up care that a family might have. So we have kind of a tiered approach to how we support the providers to get families back into traditional follow-up care and to provide parent-to-parent support or parent-to-provider support in case families have real barriers to getting into traditional follow-up care. So Jeannie is one of our loss to follow-up prevention specialists, along with Susan Piccioni in the Milwaukee area, and to some extent myself. And we actually have hearing screeners that are placed with our staff. And if providers can't get the family back into follow-up support, and the family has identified barriers to getting into support, then our staff can actually provide in-home or in-community follow-up hearing screening and secondary care coordination. If they don't pass the outpatient in-home screening, then our staff really helps to problem solve those barriers to getting in for that diagnostic eval at that point. So that has been a really important model for meeting families where they're at if a family can't access that follow-up care. We have screened babies in cars, we've screened babies in homeless shelters. Most often we screen babies in their home for a variety of different reasons when we need to. With COVID-19, obviously that has really put a damper on our ability to meet families in their homes, and working with the providers has become way more important so that we can get families back into care. So I'm gonna pause there and ask Jeannie to come on as our loss to follow-up prevention person who's on the call today, and just ask, can you talk a little bit about the work that you've been doing specifically with the out-of-hospital birth population, and also just add anything that I missed when talking about the loss to follow-up prevention work?
Well, specifically with the out-of-hospital, we also, a lot of the providers have just kind of the level 1 screener. And so we do get, like I have a family right now that needs a screen with an ABR to make, because the child has not passed in OAE, which is a little lower level. So I'll be doing that soon. I send letters to a lot of the Plain community members because some have telephones, some do not. And I just recently went out and screened a baby that the dad had called me. And then I dropped in on 2 other homes and they both let me in to screen on that day. So I screened 3 Amish babies last week. What else?
And the dad who called you has other children who are deaf or hard of hearing, correct? That have been identified through the program?
Yes, I went out and screened originally, he's about 5 years old now, a little boy that's 5 years old that has a pretty significant hearing loss. And the next set of children were triplets and they were born at a hospital, but we do put on 2 the out-of-hospital clinics with UW Audiology program. And the dad was able to bring his child that hadn't passed screening at the hospital there. And then he also brought other children that they weren't quite sure. And we found probably, he has 13 children now, and probably, I would say 6 of them have a hearing loss. But it was interesting to be there on screening last week, the whole family, which I know is not probably safe with COVID, but they were in the room just waiting for the result. It was just kind of real interesting. You know, part of them have a hearing, or have compromised hearing, and some, you know, the rest of the family is hearing. And so I imagine it meant a lot to all of them to just watch and figure out what the child had for hearing. And out of hospital, that's, we just help where we can. You know, if a patient or a family would be closer to me than the midwife, I've gone out and screened babies that way also. Try to keep their cues cleaned up. That's another part. If they contact me, I'll do the data entry for some of them, the licensed midwives. What else was I supposed to mention?
Perfect. Yeah,
Okay.
so the UW Audiology collaboration, they will come out and do a diagnostic clinic. So if families are resistant culturally to going into a clinic for a diagnostic eval, a couple times a year, Jeannie helps to coordinate a diagnostic clinic where the folks can come to a place where they feel comfortable. We did it in a schoolhouse one year. We did it in a midwife's home one year. So the families, that community feels more comfortable in that place. And so that's become quite the event. And Jeannie is really masterful at creating relationships in that community. So really lucky to have you. Thanks, Jeannie. Go ahead. You have one more thing.
Say too, I was just thrilled that the dad called me. The baby was less than a week old, and he called me to ask me to come out and screen. So that was really a good thing.
Absolutely. Good. So that's an example of being the in-home or in-community screener. Again, because it takes quite a bit of resources, we do call it the screener of last resort. So we do try to get families back into traditional care whenever possible, but feel like that's a super important component of our program. In our vision statement, it did say early and continuous screening. So this is what I've just been describing is kind of the state of what we have been doing and continue to do as a part of the standard pieces of our program. But we are this year with the new grant that just started in April of 2020. There is a focus on continuous screening. And so we are working with our home visiting programs to begin a year of targeted education to home visitation. And then also we will be placing 6 OAE screeners with 6 different programs as a pilot for home visiting to be able to do continuous screening for kids in their program. So more to come on that. We also have a tool, a screening tool, and we know that that sort of questionnaire screening is not as good as objective screening like an OAE, but we do have a tool that was created in collaboration with the State Birth to 3 program that that any program, home visiting or birth to 3, can do for vision screening or hearing screening that would help to elicit any red flags so that providers can understand when an audiology or ophthalmology referral is necessary. So we'll be highlighting that sort of screening tool as well as placing the OAE screeners and helping programs understand the importance of ongoing and continuous hearing screening. Okay, so all of that is important. We screen so that we can get the kids who really need it to diagnostics by 3 months of age and enrolled in early intervention services by 6 months of age. I'm gonna actually fast forward my slides just so that you can see what our data in the state of Wisconsin looks like. Jeannie had indicated that sometimes she helps our out-of-hospital birth midwives who don't have the same access to technology and internet as some of our hospital providers do to help them do their data entry. But we do, as mandated by the state of Wisconsin, track the screening results and hearing status results of every occurrent birth, so babies born in the state of Wisconsin. This is 2018 data. We're finalizing 2019 data. So it's a little bit older, but pretty similar year to year. So we have approximately 62 to 63,000 babies born in our state each year. We have a small percentage who are never screened. Most of that is parent refusal at the time of birth. Some of it is that babies have died before screening happened. Sometimes it's that the babies have been discharged prior to screening or were never screened by the midwife and then were unresponsive to follow-up calls or were simply lost to follow-up. We can't find them, can't contact them. Other reasons are things like the baby's on palliative care, so they're not deceased, but they're too sick to be screened. They moved out of state before screening could happen. A variety of other reasons, but it's a small percentage. In the largest population of babies screened pass the initial screening prior to hospital discharge. A good chunk screen that pass that second screening as an outpatient. We have about 125 babies who are diagnosed with a permanent congenital hearing difference at birth. But only about 60% of the babies who are diagnosed right now are diagnosed prior to 3 months of age. And that's an important statistic because it relates to some of the work that we're going to be doing around the access to timely diagnostic services these next coming years. And then we have the majority of kiddos who are enrolling in Part C. But again, getting them enrolled in Part C by 6 months of age is also an area that we have some improvement to do. So we do track these statistics in real time. We try to do what we can to intervene and support families in getting through this process as quickly as possible and as efficiently as possible, and are supporting the providers all along the way. Okay, so I'm actually going to go back to that. So let me talk a little bit about what our initiatives are around increasing access to the diagnostic audiology evaluation, and actually not just access to the audiology evaluation, because we are sometimes doing a better job of getting kids to the initial diagnostic eval by 3 months of age, but getting a confirmatory diagnosis, degree and configuration of that hearing status by 3 months of age is an area where we continue to struggle. So this grant cycle, we do have a contract with Children's of Wisconsin. They are by far our largest diagnostic center in the state of Wisconsin, seeing infants who do not pass the hearing screening. And we are working with them to engage a variety of different hospitals on quality improvement efforts so that we can make sure that kids are not getting referred to Children's without having a hearing screening in the first place, or being getting the hospitals maybe to consider doing that outpatient rescreening so that the children's audiologists are really able to focus on the kids who need the full diagnostic eval. So just doing some partnering with surrounding large birthing centers to figure out how to really make sure that the babies who need diagnostic evals are the ones who are actually getting to Children's. The other area that we know prevents kids from being identified by 3 months of age are babies who are in the NICU for long periods of time. So Children's is one of the few NICUs who is already doing diagnostics prior to discharge from the NICU. They haven't fully implemented that. They have implemented it for some of the NICU babies, but not all of them. So they're really working on getting very clear about their protocols and procedures, and are going to be increasing the number of NICU babies who have the completed diagnostic audiology eval prior to discharge. As we know, a lot of the NICU babies who are there for a long time have a lot of needs after they go home, and sometimes audiology is just not the priority. So if we can get that diagnostic eval done prior to going home, we are in a better position to help support that baby's sort of communication needs and audiology needs prior to all of the other things that they need to be focusing on. They are also hiring an audiology care coordinator to really help make sure that families are getting back into audiology services and are not being lost to follow-up, or not understanding what is required to get a good diagnostic eval when they come in the first time, so that we can get a complete test the first time they come in instead of having to come back several times. So we're really working hard on figuring out what the best practices are at Children's, and then being able to spread that to other institutions. We also have obtained funding to purchase 3 diagnostic ABR pieces of equipment, and we will be reaching out to other NICU audiology partners to begin to replicate the audiology diagnostics before NICU discharge in other areas of the state. So we're really excited about that. So we just obtained that funding last week, and we'll be working on identifying the sites that we'll be working with in the near future. Okay, I think that's all I have about audiology services at this point. So as I mentioned earlier, part of our focus has always been in making sure that families have support throughout the process of screening, rescreening, and most especially after learning that their child is deaf or hard of hearing. So we have a long history of parent-to-parent support in the state. We were the initial creators, along with our partners at WESP, of the Guide by Your Side program. That went away, and now we have, through the Department of Health, something called Parents Reaching Out, and we contract with Jeannie and Connie to be that post-diagnosis parent-to-parent support. They provide that support in a variety of different ways. So immediately after identification, because they are a part of a public health program, there is no consent required. They're just a part of the Wisconsin Sound Beginnings program. So they will send the families a card that looks like the slide here, that introduces parent-to-parent support, and lets families know that they will be reaching out to them in the next couple of days to a week to connect and learn more about what kinds of supports the families are most interested in. So they send this card, they follow up with a phone call, and then they get consent for individualized parent-to-parent support. Families can choose to be part of a listserv. They can choose to have set up regular intervals, phone calls, or Zoom meetings with Connie or Jeannie. Connie facilitates something called Sounding Board Tuesdays, which is an opportunity for families across the state to get on a Zoom meeting and talk about relevant concerns or issues. And we've been partnering a lot with West Outreach and Hands and Voices prior to COVID to do in-person meet and greets, and now to be able to facilitate Zoom meet and greets. And I'm going to actually ask Connie to come on in a second and talk a little bit more about those. That's been happening for over a year now, but our newest initiative with this new grant cycle is that we are going to be working really hard at identifying grassroots community parents, community leaders. And for the first time ever, we have a contract with an external HR department who is able to do background checks and to provide direct payment to parents who are doing work on the behalf of Wisconsin Sound Beginnings. So we have money allocated to paying community parents to take on sort of these grassroots initiatives. And so we are just beginning to start creating our database of parents who will be available to do a little bit more intensive and ongoing work on behalf of the program. So I'm going to pause there, and Connie, can you come on and just add or highlight anything that I missed?
I think you covered, the types of services that we provide for families. And the meet and greet with Wes has been, we did it in person before COVID, and we had a pretty good turnout the few times that we did offer those. And the Sounding Board Tuesday is really just this protected space for families with kids under age 3. And the meet and greets are 0 to, the teen or 21, and I possibly even 24 for some families of kids that come on. So the Sounding Board Tuesday, yeah, it's open topic, but we've also had some topic specific times. And the last time that we did it was the first time we tried Zoom. So for about a year or more, it was really just a conference line for families to come on. And the number of people that come on is very manageable. So it's really nice that, sometimes we only have a couple families that come on, but we do this thing called Delta Plus at the end to see whether they'd like to do it together again, or whether they'd like to change anything. And the people that are on are very grateful that we're doing this, and hopefully they say they want to come on again, and we all know family schedules. We try to do it in the evening when we think families are more able to come on. And what we haven't talked a little bit about is the numbers. So the majority of the families that Jean and I are able to actually reach, and they reach back by either, if we leave a voicemail, if they call us back, majority of those families are agreeing for us to contact them again. So that's very encouraging that families like the fact that we're reaching out. They actually use the terminology, thanks for reaching out to us. Many of them may not want us to call again, but they want to be on the listserv. So they're at least getting the information about the resources that are available, the opportunity to meet with other families through the meet and greets or a Sounding Board Tuesday. And then for some families that say, I don't know if I need support, Jean and I will say, well, can we touch back in a year? Sure. So we do that. And then the other thing, that when kids get to be about 2.5 or a little bit before 2.5, even if we haven't been able to reach the family initially, we'll try to reach them again when their kids are around 2.5, because we know that they're probably going to have questions about, well, what happens at age 3? And our ways of attempting is phone call. We do have the ability to text families, which is very, very helpful. And then if we can't reach a family either of those two ways, we have a letter that we send them with a questionnaire that at least tells them about the meet and greet, Sounding Board Tuesday, the listserv. And we have had families respond to those questionnaires. And then when at 2.5, before they turn age 3, we do send a transition letter. So on that letter, it does have the resources that families can connect with after age 3. And the first one that's listed is WESP. And it's a very short letter. So we just kind of list what the services are, your consultants, the Deaf Mentor Program, Parent Mentor, listserv, and really try to encourage families to sign up for that listserv, because our listserv ends when the kids are age 3, because our resources are really just for that age range. And we know that WESP has, more educational information for families. And so, yeah, I think that's about it. Texting has been very helpful. So I don't know if anyone's trying to reach families, but if you can do that, especially for the younger families, that's just a really nice way to just touch base with them. They don't want to have a phone call. So
Perfect. Thank you, Connie.
you're welcome.
Okay. So moving on.
This
Eddie,
is Heidi.
Stanford.
We have a quick question here.
Okay.
I didn't unmute fast enough. Sorry. It says first question is, do you contact families via email?
When we have email addresses. Oh, sorry, Connie, go ahead.
Yeah, so usually for the loss to follow through aspect, before there's a diagnosis, we don't have their email. So we do have the ability and we track to collect that, but I haven't seen that gets entered by the birth hospital or the audiologist. So when we connect with families through parents reaching out, we will ask for their email, and then the majority of them give us their email. So if we try to connect with them later with a voicemail or a text and we don't hear from them, or if they say preferred method of communication is email, we communicate with them through email as well. And then the second question I see is what kind of early intervention is offered? And I think Elizabeth's gonna lead into that right now.
Thanks. Yep, good question. Yeah, so the I&EDDI is intervention, and we've been working in a variety of ways over a variety of years to figure out the best way to support early intervention for families of kiddos who are deaf or hard of hearing. So we have recently, so one of the problems, okay, I'm gonna start over. We have, one of the things that we've accomplished for a while now is that we have a really strong and solid working relationship with the state Part C program. So in Wisconsin, Part C is co-located in the Department of Health Services. We have a really close working relationship with the folks in that program. We also, probably even more importantly, have a memorandum of agreement and data use agreement with the Part C early intervention folks. In that data use agreement, we actually have a connection between our data system and the Part C data system called PPS. So when audiologists identify that a child is deaf or hard of hearing, they can make an online referral from WeTrack directly into the PPS system. At that time, the Sound Beginnings program actually also sends the Part C program, the diagnostic report that's in WeTrack, to the county Birth to 3 program, and along with that, offer consultation and support around that particular child. So that has been in place for a long time, that we've been doing that work. We've been revamping it a little bit as of late, and I'll talk about that with our new positions. But so we make sure that the referral is happening. We reach out to the county right after the referral happens, and we track with more diagnostic information. And sometimes we'll send just-in-time information. So if the diagnosis is a milder unilateral hearing loss or auditory neuropathy asynchrony, we have special information that is also sent to the Part C program so that they can familiarize themselves with what's unique or special considerations about those particular diagnoses. Recently, so we do not, I'm seeing the question about, do we need a special Hipaa agreement in order to share information? So we actually do not in Wisconsin need a special Hipaa agreement, because the Wisconsin Sound Beginnings is a public health program. So under public health authority, we don't fall under the Hipaa regulations. And because we are under the same state agency, according to the Part C regs, we and our state legal counsel, we are considered participating providers of Part C early intervention. And so because of that, we don't need any parent consent to share information between our program and the county Part C early intervention providers. We do have a sample notice of rights regarding records where Wisconsin Sound Beginnings is listed, and Part C has sent that out to all the county programs. And we are continuing to make sure that counties understand how all of that operates. Michelle, I hope that answers your question. Happy to answer more of that at the end when we do our Q&A. But because of that data sharing agreement, we have been way more helpful to Part C programs because we have specific information about the child's diagnosis, and they can ask very specific questions relating to that diagnosis, and we can provide really specific support to the county programs. So transitioning into that specific support, this grant, the current 4-year grant cycle that we're in, is very strongly focused on early intervention, sort of post-diagnosis and beyond support. So enhancing our parent-to-parent support in the communities is one way that we're doing that. We're also assembling an early intervention team. And part of what's exciting about that is that it is not just the EDI funding that is contributing to that, but our more stable and long-standing Title V block grant is now really supporting our early intervention initiative, which makes me feel so excited because it just feels much more stable than it has in the past. So we are assembling an early intervention team. You met Chris Cometer earlier. She is our Wisconsin Sound Beginnings early intervention coordinator, and will be responsible for kind of helping to overall direct the program development aspects of our early intervention supports and services. We are working on a contract for a social emotional development specialist. It's an ongoing sort of process of contracting for that. And then we have 2 additional positions, an ASL lead and a listening and spoken language lead that we will be hiring for very shortly. Chris's position, along with the ASL and LSL lead, are hired out of CISA 1. So that partnership has been incredible to be working within the CISA structure, and specifically with that particular CISA, who have been really incredible partners. Our early intervention supports and services are really grounded in this idea that we want families to get connected with their Part C program, and that we can really help build capacity of the Part C program by being a team member, providing a combination of in-person and tele-intervention supports and services. But I have to say that we are still in the program design sort of team building component of that. We're hoping kind of by the end of year 1 to be ready to launch the actual model of supports and services. In the meantime, we're providing education, presentations, and consultation services, child-specific consultation services when requested. We want to be supportive while we're building the plane, but we don't want to launch it and then have to come back and change a bunch of things in hindsight. So we have a strong focus on the social emotional development component. So really focusing on the parent-child relationship, helping families know and understand relational cues of their child, focusing on sensitive and reciprocal response building between the parent and child, all of which is important for communication development, regardless on mode or method of communication the family chooses. So that's where that social emotional development specialist becomes so critical to the model. we are supporting Chris to go through the Wisconsin Infant Mental Health certificate program. We are really foundationally set in that sort of framework as we build our early intervention supports and services. So I am going to ask Chris to come on and add any additional things that you would like to add to that.
I'm just very excited to be able to be working on this this part of EDI, so that families all over the state will have access to, and the counties will have access to some specialized support. So as Elizabeth said, right now it's just I'm sending out the diagnostic audiology reports from WeTrack when there's a new referral to a county. So I'm starting to make connections directly with all of those counties where there are new referrals, and they're welcome to contact me for, like she said, an individual kind of one-time consultation, but not to be an ongoing member of that team at this point, because we haven't, as she said, fully developed our design, our model of exactly, and we don't have our full team together. But we've got people, some counties have already been contacting us for that kind of support. So in addition, I feel like I have a pretty good good understanding of the whole primary coach approach to teaming, as I've worked with it in my previous job. So we worked with counties in Southeast Wisconsin on the PCAP model. And so we're just excited to be providing support through that to the counties. I guess that's enough for now. There might be questions coming up, and I'm happy to answer other questions.
Thank you so much, Chris. We're just thrilled to have you helping us to launch a statewide early intervention support system. And like I said, it's going to be a combination of in-person and tele-intervention services. And what better time than during COVID-19 to launch tele-intervention? So we are working really hard on getting all of the wheels in place so that when we have our full team assembled, we can kick this off. Okay, so I know we are running out of time, so I'm just gonna move on. Another really exciting, long overdue component of the most recent grant is related to providing access to deaf and hard of hearing role models for families. So we have a variety of goals and objectives related to this particular topic. We have been and continue to work on a project called Sound Futures. And Sound Futures is a video project where we have conducted interviews with a variety of young deaf and hard of hearing individuals ages about 17 to 23, and have asked them to tell us about what life is like as a young person who is deaf or hard of hearing. And I did put a Vimeo link in the chat that you can go and take a look at. It's really just the introduction to what Sound Futures is. The intention, I've actually been working with a young deaf adult who I think is going to be a sophomore in college this year. We started working on this as his high school project, and an AUD student and myself were working on this. We have sort of collected and edited 6 videos that are ready for viewing. So they're about an hour-long interview, and we condense them down to about 5 or 6 minutes. We're really trying to highlight different kinds of stories of success. And so picking particular themes that we think families, new families of identified infants and toddlers might be interested in hearing about or seeing. They're captioned. We are working to try to figure out how to also make them available in American Sign Language. So we're working on accessibility pieces, and what's really limiting us right now is we don't have the platform to put them on so that they're accessible. But we also have we're continuing to collect interviews, and we've just done 4 more that are now needing to be edited. So we'll have 10 total, hopefully by the end of next month, that will be ready for viewing. So we really want families to just have access to kids who use all different kinds of communication modes and methodologies, who have had all different kinds of schooling experiences, who identify success in really different ways, who have different kinds of hearing statuses, and who represent different race and ethnicities, who represent different sexual orientations. Like, we are just trying to really capture the beautiful heterogeneity of this population, and have families just see that there's a tremendous amount of hope in how infants who are deaf or hard of hearing can live their lives. And so Sound Futures is one of the projects that we're working on. Additionally, we will be working very hard on recruiting deaf and hard of hearing community members, similar to how we were talking about recruiting community parents who can be paid for the work that they do in their communities to support families. We will be looking to recruit individuals with lived experience to be able to do a variety of things. Sort of talk with County Birth to 3 programs about what it's like to live as a person who is deaf or hard of hearing, talk with families about what growing up was like being a person who's deaf or hard of hearing, serving on different working groups and things like that. So again, we will be building this database of individuals who can be paid directly through our new HR contract for the work that they have to offer as far as statewide support of families and providers around being more versed in understanding what that lived experience has to contribute to the system. So we will be looking to recruit deaf and hard of hearing role models. A lot of the kids who actually have been part of the interview team for Sound Futures are very interested in also continuing to be called upon in that capacity as well. We would love to include young adults who are dual sensory impaired. We have a young man that we just interviewed who's deaf and has CP, and he was one of our best interviews ever. I think he just did such a great job, such a cool story. So if you know of kids that you think would be great interview candidates, please let us know. We're still actively recruiting those stories and trying to increase the diversity of perspectives that we're featuring. Okay, so I think that is the overview of our program and what we're currently offering. I would love to invite Jeannie and Connie and Chris to turn on their video and microphones, and we will, I'll stop sharing my screen, I guess. This is my contact information. If anyone doesn't have questions now, but thinks of questions later on, or if you have contacts for deaf and hard of hearing role models or interview candidates, please let us know. If you have a need for early intervention consultation about a family, you can go ahead and contact me and I'll connect you with Chris. Just go ahead and copy that email down and be in touch as you like. And now if I can figure out how to stop sharing my screen, I will. And then I think we'll open it up for questions. Right, Stacey?
Yes, ma'am. We will. This is Stacy. We will open it up for questions. And just to let folks know, when we're done with our professional development opportunities here, we have been posting the slides in our Canvas community, so you can access the links or resources there. And when we post that, we will also include the Vimeo link that Elizabeth had put in here. So before we're done today, make sure you kind of go back in the chat and get that Vimeo link from her so you can watch that video and see what they've got produced so far. So folks, if you have questions, you can either type it in the chat or you could also unmute your mic if you wanted to ask rather than type. So I just want to say, this is Stacy again, before as people are formulating their questions, is to thank the Wisconsin Sound Beginnings team for their updates. We knew there were lots of new and exciting changes coming down the line. And for me, I've been doing this as long as Elizabeth has, so it's really exciting to see kind of this new infusion and support for birth to 3, because, you know, as outreach, it was really tough because we're separate systems and we hit some snags and challenges there. So I personally am so thrilled that you have an opportunity to kind of get through some of the red tape by being in the same system. So it's very exciting to see what you guys will be doing in the next year or two here with early intervention. So we're here to help support and share ideas. So good luck with your projects.
Thank you so much, Stacy. Yeah, and I just want to recognize that one of the things that we're really considering in the program design and development is transition, and how we really make sure that we're partnering with the 3 and up sort of community to make sure that families feel well supported, to be able to do a soft handoff, to be able to make sure that families have a good understanding of what's to come after our support and the Part C supports end. So we'll be reaching out for sure as we start thinking more carefully about how to design that piece of the system. I'm seeing that there's a question about the screening questionnaire, and it is on the DHS interweb, and I'm going to try to find that as we're answering questions here. If not, Stacy, can I get it to you after the call and you could link it like you are the Vimeo link?
Absolutely. Whatever you want to link or share, we can put all those posted together in one place.
Okay, great. When a child is identified as having a hearing loss in the hospital, we are trying to figure out a way to have the child's retina and or vision checked as well, especially if the child has or is suspected of having any syndrome. Any ideas? Well, first of all, I commend you on trying to do that. It is definitely aligned with the recommended best practices, and finding an infant ophthalmologist is really challenging. So I understand that. We do have a list, or I'm not sure how updated it is, of infant ophthalmology resources on improveedi.org. I'm going to type that into the chat. There's a find a providers section of that website where you could go and see if there are resources that you're unaware of. We are, one of the big contracts that we have in the current grant is an IT contract to help us improve our website, to create a parent portal to our current website, and to update a lot of the links and such, as well as to create a landing page for the Sound Futures Initiative. we were hoping to contract with the University of Wisconsin Department of Information Technology. But as you can imagine, with the entire university going online, they are swamped right now and have not been able to address our contract needs. So that is on hold for the moment. But so don't judge our website too bad. It's in a process of a revamping. We just haven't been able to get the contract in place to do that yet.
Elizabeth, were you referring to the typical hearing developmental milestones and the typical vision developmental milestones that was developed by that subcommittee?
Yes.
The screening tools. So they are on the Birth to 3 Forms website, and the vision or the hearing screening, the typical hearing developmental milestones is form number, well, I can put it in the chat.
Can you just put, can you type that?
I'll put it in the chat.
Yay, thank you for helping me.
Sure.
And I see that there's a lot of, good.
This is Heidi. I also shared in there the infancy.org information. So those are oftentimes for babies similar to when they're in the NICU, often the vision isn't fully developed yet. So oftentimes you run into challenges with them even being able to assess vision because it's just not necessarily, I mean, unless they're looking for something very specific, to do just a general eye exam is very challenging. So the infancy.org is a no-cost eye assessment. And so there are volunteer optometrists throughout the country that will perform these eye exams for free for infants aged 6 months to 12 months. And similar to like the newborn hearing screening, they'll do sort of this eye assessment and they will refer you to a pediatric ophthalmologist if they feel that there is a concern at that state. So I put that in the chat as well.
Thank you so much for that, Heidi. Yeah, that's super helpful. Chris, can you also put the link to the website in the chat? Just copy the actual link, that would be great. So when I had mentioned the 6 OAE units going out, our plan with home visitation is that I will be doing a series of presentations. So one presentation, and they'll all be focused to home visitation programs. So one will just be about like what is hearing and hearing loss, what is the Wisconsin Sound Beginnings program, and then you know, how do you do objective hearing screening and why does that matter? Once we do those presentations, we'll be asking programs, home visiting programs, to self-identify if they would like to be part of our objective hearing screening pilot. If we have more than 6 programs who identify as wanting to participate in that, then the home visiting team will figure out which ones they think are the best match. And then once they determine that, we'll be sending out the equipment. There is an early childhood hearing program that is got a ton of excellent resources on it. And it is called the ECHO project. And I'm going to put that, and that's been around for a long time. I'm going to put, it's actually kidshearing.org. Is that right? ECHO. I'm looking for the internet site, and I will put it on here as well. So there's a lot of training tools and things like that up already that will be really helpful for instituting that project. Okay, here we go.
While there's a pause here, this is Heidi. I'm just going to also point out that Tracy shared that Vision Forward, at least in the state of Wisconsin, they are also available. They have resources, so feel free to reach out to Vision Forward as well.
So, and then I'll answer Lauren's question. we, and actually, or WESP can. My understanding is that the Deaf Mentor Project is not available to families of kids 0 to 3. So Wisconsin Sound Beginnings is trying to, in a little bit different way, fill that gap through our deaf and hard of hearing mentor program. So we are a role model program. Sorry, we have the deaf hard of hearing role model program. How you guys are going to keep these 0 to 3 versus 3 and up programs straight, I don't know. But so our parent support program is parents reaching out. Our deaf hard of hearing to parent support program is right now our role model program, DHS role model program. It is possible that we will have, you know, fluent ASL users who are available to work with families on learning American Sign Language in their home as a part of that role model program. We're just still trying to figure out who our people are, get them into our system so that they can be paid and do some training. It will be different than the Deaf Mentor Project, which has a full curriculum and is very structured, and so it will be different than that, but there is some ability to support that sort of cultural and language connection with another adult who uses American Sign Language. Also, we have access to a sign language curriculum online called Sign It. Any family of children 0 to 3 have free access to that program. It was created by the person from Signing Times. I think it's 2 semesters. I think it's equivalent to 2 semesters of like a college ASL class is my understanding. So I know online isn't always the best way to learn a new language, but it's something. So that is also something that we can offer families.
And then this is Connie. The other thing that we do, Jean and I, if families do indicate the desire to learn sign language, we have a document that lists, it also, on the document lists Sign It, but it also has a link to the Describe, Caption, and Media program, which houses the Bravo Family Beginning ASL course, which is what is required for families to complete in order to get a Wisconsin Deaf Mentor. So we're encouraging families to do that. You can stream it, or you can get the DVDs postage paid sent to you, and you can return it postage paid. So then when their child is 2.5, they can request a Deaf Mentor. So Bonnie Eldred had said that can happen at age 2.5. So we're trying to make that clear for families as well. And then there's other resources that are listed on that document, like online dictionaries and I feel like I've found that families, I know Elizabeth, you were saying that virtually might not be the way to go, but for families that have young kids and then other kids in the family, it is a easier way for them to access it. And then we all know Wisconsin weather, or signing up for in-person sign language classes, you need to have a certain number of people signed up. And so the virtual ability is really good for this age range of kids.
And then I guess I just also want to point out that, you know, having our ASL specialist on our early intervention team will also be a large, you know, part of that person's role, is to help support access to ASL through early intervention.
Okay, this is Stacy. There's a couple more comments. Is that you guys are correct that Julie Homa put the link in the chat. So a few years ago, the funding was shifted and rearranged and all that kind of stuff. So yes, at 2.5, Deaf Mentor program is an option for families. So Julie put the link for requests here. And then there's been a couple folks who've sent me private chats wondering about all the links. So I will, when we're all finished, we get a copy of the chat. So when we post the slides and everything else, I will pull off all these extra links that we've added in the chat room, because I know it's hard to pay attention and check links and get them all to pop up. And so we will make sure that everybody has all of the links and all of that good stuff.
Thank you, Stacy. That's really helpful.
Okay, and also Julie also put in here that Deaf Mentor is virtual. We have set everything outreach virtual through the end of the year because we just decided it's so hard to plan something, you know, in person and then make the shifts right at the end. So we are going forward cautiously. So all of the meet and greets that Elizabeth and her team mentioned, that's one of our collaborations with Sound Beginnings. Those will all be virtual. And, you know, I try to always look for the positives. We've come out with some really cool tools out of being forced to find them and learn them through COVID, just like all of our professional development comes to you through a virtual format now. So look forward to that. We will have more coming in September for you guys. We will be meeting the second Friday of the month for the whole school year for professionals. And then we have some other things in the works. Our parent, we were trying to do a parent weekend. That will be a virtual event in November. So I don't think we have any other questions that have been posted. So I would just like to thank the Sound Beginnings team for joining us, and we'll look forward to more collaborations and more exciting stuff coming out from you guys. So thanks everyone, and have a great rest of your week.
Bye everyone. Thank you.